The moment I decided I wanted to be a physician was actually a moment. I was a chemical engineering student. My brother was in medical school at the time, and my father at the time was a physician. He currently is retired. And he would come home from medical school and they would discuss things that he was learning. And I was much more fascinated with what he was learning than what I was learning. So this was halfway through my fourth year of college, which required me to significantly change my path. And it absolutely was one of those, I must do this because now I know my passion. A physician can have a significant impact on preventing a stroke or preventing a heart attack or treating someone's blood pressure and making sure it's in control and making sure other aspects of their preventative health are there. So you have every aspect of the disease. It's a fascinating physiology and pathophysiology, which I always loved. The accurate diagnosis and precise diagnosis is one of the things that I spend the most time on, and a misdiagnosis can lead to months, if not years, of poor outcomes for patients. I have a grandfather who's currently 96 years old, and he had his first heart attack at age 41. He had a second heart attack at age 81. He had a third heart attack at age 87. And many people would look at that on a piece of paper and be like, what are we doing with this person? They're 96. Why are we doing all these procedures? He's had 3 heart attacks. This is way too much. But my grandfather has 4 children, has 8 grandchildren, has 16 great-great-grandchildren, and he's absolutely lucid. And he's the joy of our family. And we all love spending time with him. And so every single patient has that story. You just have to find it out. I will never forget this patient. When I met her, she was 22 or 23 years old. She was a college soccer athlete. When I met her, she was weighing around 70-something pounds because her heart was so weak that she couldn't digest food. Immediately from that clinic, we brought her into the hospital and we implanted a heart pump. And 6 months later, she got a heart transplant. And now she's 3 or 4 years after that transplant, looking like an elite athlete again, working a full-time job. It's my nature to be a relatively humble person, and I think humility is very important in this profession. But there are days where you know that you made a huge difference in someone's life, and maybe a difference that would not have been possible if you were not involved. I am Dr. Kia Afshar. I am a cardiologist practicing with the Intermountain Heart Institute at Intermountain Medical Center.